like I mentioned, my name is Rocio. I am currently the clinical program manager for Fresno Family Counseling Center. Just a little bit brief intro. I went through the program myself, and then graduated in 2011, roughly, and then moved on and worked out in the community. I was a program manager for the perinatal mood and anxiety disorders at the California Health Collaborative and did manage services for about roughly 8 years or so. But predominantly we worked on with this population that we're just going to go over. I want to be able to make sure that you guys have a brief glimpse of what this is. 2 hours will not be enough to be able to provide you this information. I just want to make sure that I give you this disclosure that it entitles more information, more in depth, really going into what certain situations really look like with birthing persons and also dads included as well, what all that really encompasses. But again, it's just going to be something very brief that we're going to introduce and provide more of a wraparound of what a support group could look like. But even though that I'm going to provide that, what can that look like working with individuals on the like I said, working with individuals on the individual basis. So let me go ahead and see. Um, Let me ask, any of you have worked with this population in the past? Do we have anybody worked with infant mental health?
I've only worked with like new moms, just like volunteering in the mother baby unit, but that's about it personally.
Mm-hmm. Okay. So like I mentioned, there is a lot to really look into. And so that is just something that we're going to see. Hold on. It's not cooperating with me. All right, now I want to transfer it over here. All right. Oh my goodness. Okay, there we go. Okay, can we view this?
Yep.
All right, thank you. All right, let's get going. We're a little bit behind. So I think here, what we are, this is just a guide. Like I said, it is only something to facilitate. It is very brief. It's not something that we do have got into details, but I will give you just an overall glimpse of what pretty much the peripartum, postpartum world looks like in population. And so, this is something that we can utilize to, again, conduct groups, but also facilitate it in a more in an individual basis as well. And we'll provide you information as well as how we can work together with providers out in the community as well. Hmm? Okay, there we go. I think one of the things that we do have to always make sure that we are when we are working, whether if it's in a group setting or not, and I know that a lot of you are doing this with groups as well, is that we want to make sure that we are able to provide the safety environment for them. A lot of it at times as well is continuing to use those core conditions, right? And be able to provide that unconditional positive regard and respect. Be there attentive, being able to be there and listen to what they're, what are they experiencing at the moment. It is really important that we do make sure that we are consistent with also being able to provide that culture of humility and sensitivity, because we just don't know what their experience has been like, whether it has been something that has been traumatic, something that they have experienced any adversity since childhood or recently as an adult. And so we just want to be able to mindful and be able to have those considerations as well. So, okay, I'm gonna go into the approaches. I'm not gonna go into groups. I'm gonna go mainly more into what it is, right? One thing with working with this population, their ideation and crisis is very prevalent and is very high. So I think if anything, with at all times, we do need to assess because their way of understanding what depression may be or anxiety may not, they may not understand what that really looks like or that entitles. They only can see certain symptoms, and really maybe a lot of them may have not even noticed that was an indication that they might have been experiencing any depression or anxiety during pregnancy and after childbirth, or if they were already had a history of any mental symptoms or any mental diagnosis prior, right? So we do have to keep that into consideration. Right. So understanding one thing that we have to learn about this world is understanding what the baby blues like versus perinatal postpartum depression or peripartum depression as well. There are many different labels and words that we can utilize, but I have to understand that for most birthing individuals, it is common for 50 to 80% of individuals to experience a fluctuation of emotions and also transition and changes within that process, right? We have to understand and really understand the experiences that they might have been exposed to during pregnancy and after delivery. So, typically a lot of the symptoms do tend to wear off between 2 to 3 weeks. Any symptoms arising, continuing after 3 weeks or so, we do have to make sure that we pay attention and monitor and really assess for what that really looks like. Understanding for some of us that are may be parents or those that may be first-time parents, I know that, this may be a lot of information for us to really grasp, but understand that it is very common uh, for birthing persons and or dads as well to feel all these emotions of worriness, sad, overwhelmness, excitement. But understand that on the other side of it, there will be sleep deprivation, there will be a lot of fatigueness, there will be a lot of adjustments, and making sure that as adults adjust to the new integration into the integrate into the family, to be able to make sure that little one is being taken care of, right? I think ultimately, when we do bring a child into this world, that is the most ultimate thing, is to be able to provide that support, and safety and growth, and make sure that they thrive, right? Understand a lot of the different symptoms that they may arise. As far as what depression may look like, would be a lot of irritability, right? Again, we have to monitor and ask what the significant changes as far as sleep disturbances are they having? Are they sleeping at least 4 to 5 hours in a day? Or are they not? Are they sleeping 1 or 2 hours a day because they have to be getting up at night constantly to feed the baby? Or are there other complications? Is baby irritable? Are they gassy? Are they just trying to just monitor and figure out what is going to be the best approach? And parenting, as parenting, we really want to be able to think about that, what parenting looks like for them and how are they navigating it. One of the clear things that I always make sure is that I assess to make sure that everybody is eating, is drinking liquids. If they're not fully eating meals, are they eating snacks? Are they snacking in between? Right? If they're breastfeeding, are they consistently making sure that they are taking any supplements? Are they intaking enough fluids to be able to manage not only their nutrition, but as well as the nutrition for the baby, right? What does that look like? But as well, going back into what the symptoms really look like, are they expressing this? Is there over concern over the baby, right? Is the birthing person feeling inadequate as them being able to provide or be the best fit for their little one, right? I think we also have to assess, is there any intense shame and or guilt? Right? Are they, what changes have dramatically happened in order for us to make sure that they are able to navigate and just throughout the process, right? Again, we want to make sure that have they had any passive or active suicidal ideation. Um, it is very common, but again, like we understand that it's not normal. Right. And so this is a population that we have to really be concerned of, is because, for birthing persons, this is the second leading cause of death within the first year. Not only for them, but it also be any possibility or chances for harming child or any other children that may be in the home. So again, one of the things that we do have to really look into as far as when it comes to any anxiety, finding out what is their thought process. Are they constantly having these ruminating thoughts? Their brain doesn't shut off, right? They're constantly thinking about what's going on. Are they imaging, having certain images? Are they worried that their child is not going to be well fed? Are they doing the best that they can? Right? Again, parenting styles will come into place, right? We do have to assess at times also culturally, when we become parents for the first time, or consecutively, or moving forward, what does that behavior look like? Is mom allowing dad to be able to bond, right? To be able to have that connection, that physical component. Are they having skin to skin? Are they interacting? Is their support system, are they able to bond with child as well? This will come into anxiety and more of a OCD behavior, not personality, but almost OCD behavior, that mom knows best, and mom will want to just be the one that will be providing and or taking and or sheltering child. Right. I think these are some of the things that will really make a big difference in really understanding what those individuals are really experiencing them in the moment. One of the things that we also make sure that we have to assess, are they having panic attacks? Are there instances in where they're feeding their child, and all of a sudden they just feel super overwhelmed, just because also if they have been having the lack of sleep, or maybe they feel that a child is not being that they're not able to feed them enough, right? These are common things that we worry about, especially for for birthing persons as well, or for women as well. Sleep, become very sleep deprived because they just want to make sure that nothing happens to their baby. Right. I know that, some of the examples that I typically tend to give is that, some individuals will stay up at night and constantly be checking, either to see whether if the blanket is moving, are they breathing? Typically also, parents will place their finger under the baby's nose, just to make sure that they are breathing. And so this is something that we do have to monitor. It is within nature, and it's also a common reaction for them to be worried, but we have to make sure how extensively and how excessively is that occurring. Right? Do we have any questions? Feel free to ask.
Rocio,
Right?
are we gonna
Yes.
go over like um inter I guess like yeah, like interventions for how to go about addressing some of these things, like the perinatal generalized anxiety disorder with like mother specifically?
Yes.
Okay.
Yeah, so what I wanted to say is, again, it doesn't matter who you are, where you come from, economic or social background, this can happen,
Mm-hmm.
not to women, but also to men as well,
Mm-hmm.
right? Some of the things that I say is that, for women, it usually takes about, birthing persons, I say, it takes about, usually roughly a year for their body and their mind to go back to normalcy,
Mm.
right? If there is such a thing that calls as normalcy, but we have to make sure that that takes time of adjustment, and also take into consideration as well as have they been having children back to back, right? Do they
Right.
have a lot of children under the age of 5, right? Those are the things that we also have to be able to assess. Right. Some of the data, this is really outdated, but one in three women will experience perinatal anxiety disorders in their lifetime. If they have experienced it prior, then that is something that they will, consecutively also go through and during pregnancy, continuous pregnancies as well. The likelihood of that. Most of the time, they learn, they manage, they know how to manage, they learn coping skills, but there comes a time where they just max out on how the way they're able to manage, right? So I want to be able to be clear as well as what the obsessions look like. Um, I know that we're all in mental health, and we know a lot of these certain diagnoses, but we really have to pay attention that we are able to ask all these different type of questions if they do arise, right? What type of compulsion are they having? And I'll give you an example. I had a mom that I was just doing an outreach presentation, and I had a mom that was letting, really going into just sharing about how she was so happy to have her child. But when it came upon to taking care of her child, she did have this OCD person behavior where it didn't matter what time of day it was. If her baby was soiled, then she would prepare the environment to give her a bath. It didn't matter whether it's 2 o'clock, 3 o'clock in the morning, she would bathe her. Right. And so this is something that wait a minute. That typically would not be a normal behavior for many of us. Right. And so that's just, those are just some of the things that we would have to, think about. And also if they are experiencing or having these intrusive thoughts of images that may arise. Right. So I want to be able to make sure that we are able to ask all these type of different questions. Um, you know, One of the things is a constant rigid changing, right? Constant rigid washing hands, constant rigid making sure that whoever is overlook, taking care of the baby or the child, that it is being done perfectly up to their criteria, right? And so these are the top of the things that we also have to think about what's really going on. um, a lot of the times as well where they interfere also with bonding is also if they have experienced their own traumatic events, right? We do have to think about whether they experienced past trauma or if they had a traumatic labor as well, right? Those are the things that we really don't think about. Like, well, it is normal for there is going to be a routine, and there's going to have to be an adjustment when they are delivering, a mother's delivering, a birthing person that's delivering a child, but we don't really think about the other things that can come across if it's not something that is expected. Right? We have to also assess, do they have a support system? Do they typically tend to isolate themselves? What type of what type of impairments does mom have, and that is lacking them from being able to bond with child? Right? Did they not experience nurturing, or did they not have bonding with their loved ones, or guardian parents or parents in the past? These are a lot of the things that we do have to think about, right? Were they exposed to sexual trauma? Right? Is it something that is holding them from really bonding with their child, or creating this type of compulsions around um taking care of their baby, and or children as well. Um Again, some individuals may come across to you and feel like they have been cheated, not only from the staff from the hospital, but just the overall care. I think that these are some of the things that we have to validate, and support individuals that may be experiencing this. And so, one of the clear things that we also have to understand is that being able to ask individuals that you do work with or in support groups, are they parents of a NICU baby, right? Were there complications within labor, or there was already complications within the pregnancy that we already, that they were not foreseeing or foreseen, right? This is something that can impact the connection and nurturing and also development of that bonding with the parent and child as well. And also overall, also making sure that we are making sure that parents are okay as far as their relationship is concerned. Because this can also impact the relationship of adults, right? So this is something that we do need to make sure that we keep an eye on. Sometimes we don't even realize that that could be also an indication why there may be that disconnect as well, or there's always constant friction. One of the things, I can say, with NICU, babies, when a child has been in the NICU, they'll be NICU babies for the rest of their life. And that's just something that we as adults, and whenever you become parents, we are working with parents, that we bring in that support. Right. And again, like I mentioned, always constantly validate their experience and allow them to process and manage along the way. This can also reduce a lot of the anxiety surrounding wanting to have multiple pregnancies moving forward as well. Okay. One of the things that we have to also focus is the impacts of fathers as well, right? The lack of sleep will also have an impact on dad as well. It does create hormonal changes within dad, even though dad did not biologically have this child, right? We do have to be able to also understand that now this is a bigger situation where there's a lot of commitment, obligation, or responsibility, not only within the unit of the family, but also how are they going to be able to be managed and playing that in that role, right? One of the things also, that we do have to consider and really focus on is the relationships that they are having with either both sides of the families, right? Is there no support? Is there any financial distress? All right. Again, we always have to make sure that we are we are paying attention to what the bond is between mother and baby, and also dad. Right? Impact on fathers, again, approximately 50% of all men will suffer from postpartum depression themselves, right? A lot of it is being able to manage, being able to be present, and also, being able to provide that emotional component for their children, but as well as the whole family. Right? Okay. One of the things that we have to consider, and sometimes we really don't really look into or ask, is that was there any other complications? So these are some of the risk factors that we do have to consider, as far as was there any other medical complications, right? Was this an unwanted pregnancy, or has there been any perinatal loss in the past? Has there been any miscarriages or stillbirths, right? Those are the things that we do have to be able to ask, to be able to understand, and also be able to support the symptoms that they are, currently experiencing or they have experienced in the past. Are they currently going through IPV? Has there been any exposure of substance abuse from birthing, the birthing parent, or also the dad? Has that been a situation in the past? Abuse. Again, all these factors, social support, isolation, or poor support, will be high indicators that individuals will experience depression and or anxiety. Yeah. One of the things that we also have to understand is that, and obviously we do know, is that the lack of support, if it's not treated, birthing persons will deliver babies that are preterm birth or low weight babies. And I think this is something that we have to be very critical. One of the things that we also have to be mindful of is in the, birthing persons experiencing preeclampsia, or even after delivery as well. What does that really look like? As far, and I'm not gonna go into a lot of details, but like, again, we don't have, for the sake of time, this is just a brief, information of what this can include. All right. So Again, as we move forward, again, we always have to make sure that we do assess at all times, like I had mentioned previously. And it is important that we do. Um, one of the things that we do understand is that is if the birthing person was experiencing depression or anxiety during pregnancy, chances are that it's a predisposition that child may develop that in the future. If there is there if a child has not been able to connect with the a functional healthy individual, we all understand that there is going to be that lack of attachment or the inconsistency of attachments. And so attachment is really key important to be able to ask when we are working, when we are providing a service, or when we are working with individuals that are currently experiencing um, depression or anxiety during pregnancy and or postpartum. Teenage parents have a 50 chance higher increase of depression and or an anxiety. So we do have to make sure that we are exclusively paying more attention to our adolescent parents. Right. I think a lot of it is also the hormonal changes that they're experiencing, but just overall the adjustment of having to being able to learn how to identify as an adolescent and completely transitioning into becoming an adult can also create a lot of 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 a lot of adjustments within the family, but with also within their own immediate family when they do become parents. So again, here with the treatment options as far as we're mental health providers, obviously being able to work with talk therapy, using EMDR, any other form of other modality that is out there to support electrical shocking. I mean, I know there are a lot of individuals that are willing to seek that approach because it's they try different methods, more of the holistic approach and or more of a CBT approach, but they're also willing to utilize other options. One of the things also that we do have to be mindful of is that if individuals have been in treatment for quite some time, we do also have to be able to be open about considering and talking about antidepressants or SSRIs, utilizing during pregnancy and especially also when they are breastfeeding. Um, because we want to make sure that they are not taking any medications that would have any conflict with their pregnancy and causing any other form of conditions during pregnancy and also after if they are, like I said, like I've mentioned, if birthing persons are breastfeeding. So this is pretty much what you would look into as far as, like, let's say we're setting more of a group support. We want to make sure that we are able to provide immediate being able to connect and build that rapport, right? So a lot of the things that we can use is deep breathing, right? These are some of the coping techniques that would be really important for us to be able to utilize and also to ground. Um, Again, this is a technique that can be utilized not only for individuals that may not be in this experiencing perinatal anxiety disorders, but this goes a long way for individuals that are experiencing anxiety as well. Right. One of the things that we need to make sure that we are able to provide them with the understanding of them being able to have that self-care, right? Making sure that they are able to take care of themselves. A lot of the times we don't really, they feel that they have to be at all times, at all moments, being able to take care of their little ones and really not set that time for themselves, right? I think it's more important that we need to take care of ourselves so that we can also be able to support and be able to experience those moments that we want to enjoy with our little ones. So again, we also want to be able to make sure that we ask, what was their self-care today? Was there any moment in time, brief, a couple of minutes, At any point in time, it's really important for us to really be able to provide them with that support and them being able to monitor what that self-care really, really looks like, right? Um, Again, this is something that we went over previously. One of the things that I do want to make sure that we are able to provide as well is, again, if they are taking medication, to really assess what they are what they are taking, just to see also to be able to see what symptoms are arising as well. And if there are any changes, right? Is there any hormonal changes whatsoever? I know, Ashkin, I know you were asking if I was going to provide any um resources or tools.
Yep, yes, mm-hmm.
Okay. Yeah, so a lot of the things we have to really understand this first before be able to provide those tools
Yeah.
moving forward. One of the best things that we can utilize is that with mom when birthing persons or individuals overall, the whole family, if they find themselves not connecting with their child, is that they do baby massage, right? That's not only provides that connection, but it provides that skin to skin, and that really changes a lot of the serotonin and endorphins, not only in baby, but also in that, in those individuals that are in that instant moment, right? They are creating that situation in that moment. That is super important that they're able to be able to understand. A lot of them individuals that I have worked with always say, well, you know what, this was a pregnancy that was unwanted. I really did not connect with my pregnancy whatsoever, right? They feel the sense of numbness. And now, once their baby is here, they do feel that shame and guilt, right? And so at times we have worked with that, being able to do that um, baby massage, right? That skin to skin, because that reconnects, that rewires, and that reconnects the child, the baby, but also mom as well. Or again, whoever is doing baby massage, is really, really, really works. I talked about medications, the side effects, and also with breastfeeding, we do have to be mindful of that. Things that we need to be, and also as providers, we need to make sure that we are able to communicate with the health provider and find out what they're being treated for. Again, focusing on the pros and cons of medication while they are, whether they are pregnant or breastfeeding, right? And what is it exactly that they're going through in the moment. So again, exercising and self-care, it really not only promotes recovery for the birthing person, but also again for the child, right? Being able to walk out, obviously these are some of the things is that if an individual is very heavily depressed and they're not willing to step out of their home, or wherever they reside in. Just one of the things that we can support them with is making sure that they are able to go onto their window and get that sun rays. The sunlight is really important for them to provide not only vitamin D3, but also provide D3 as well. D3 actually, if we could take it in consumption, we can support also and limit some of the symptoms that individuals can get when they are depressed. So vitamin D3 is really important for individuals to utilize. And this is something that they could take on their own, but obviously going back to their medical provider and asking, okay, how many units of vitamin D can I take? If this is something that maybe also they don't want to go that the prescription route or the medication route, what other things can they do besides before going into making that choice, right? So again, doing setups and push-ups, really doing more form of yoga with the little ones and participating. Not only are they recovering and healing themselves, but also providing that engagement with babies, right? Again, one of the things that we have to make sure is sleep. We have to make sure that we do assess sleep. If they're not able to sleep throughout the day, if adults can have increments of 90 minutes, then that is something that there is going to be manageable for them to make sure that they are little by little recovering their sleep patterns, and it does not constantly disturb. For children, for little ones, it's 60 minutes. All right, so I think it's really important that they are able to understand that if they had a very long night and they weren't able to sleep whatsoever, if they can set some time throughout the day and sleep in 90-minute increments, then that is going to support them um, along the way. Right. Again, a lot of the things that we also want to keep in mind is that when they are experiencing depression or anxiety, we want to make sure that they're monitoring it. If they're not able to journalize, can they jot it down? Right. And really journal what they were experiencing, what they were feeling in the moment. Can they take baths or showers? Right. Showers or water is very healing. Right. Is that something that they can do to be able to, take care of themselves? Or again, as well, breathing techniques. One of the best tools that I really like to utilize is a muscle relaxation. Even though that is for more trauma-based approach, this is just something that we want to make sure that we are able to allow them to be able to utilize. And not every technique or approach is going to work for every individual. Right. I think we also want to be able to make sure we ask their social media consumption. Right. A lot of the times as well, I've come across with individuals and work with individuals that are experiencing a lot of anxiety, and a lot of it is news driven, what they're seeing on social media, right? That just flares up their anxiety, and it really worries the safety for themselves, but also the safety for their child. All right, so a lot of the things that the best approaches that we can do is make sure that they limit their social media intake, just to monitor and see if their anxiety is stabilizing, right? We want to always make sure that we stabilize and that we reduce, right? A lot of, we also want to make sure, if they're taking any caffeine, what does their intake look like, right? A lot of caffeine overstimulates, and is not going to support sleep, nor if you're experiencing anxiety symptoms as well.
So I
Being
had
able
a
to have,
question.
yeah,
What are your thoughts on like co-sleeping?
can you elaborate on that?
Like, when like moms, want to have their kid like the baby in the same bed with them, or like right next to their bed, like the crib kind of like attached almost to the bed. Like, what are your
Right.
thoughts on that?
So there are options for us. I know that in California, especially here in the valley, because there is a lot of SIDS, there was a high increase of sudden infant death syndrome. And a lot of it was at times because, again, um it depends on the culture, right? It depends on the upbringing. It depends on what they're being told or wanted to do, their expectations. I think it's something that we have to be able to explore with them. There are a lot of cribs, there are a lot of um, gadgets right now that we can utilize to be able to have a child stay safe, because they feel like, well, this is the only way. Maybe they're having this OCD behavior, like the only way for me to connect is to make sure that that child is right next to me, so that I know what they need at all times, and I know that they're going to be safe. We want to make sure that we create a plan over that. And what does that look like? Do they have a there are boxes, now that children can be placed on, but there was a point in time where we were in the community where, like, well, why are children being placed in boxes, right? I think that was more of a safety issue, to make sure that did not occur, where baby would be suffocated because adult would sleep and not realize what was going on, because those things do happen. But I think it just depends on the connection. We do know that when children are sleeping with their little ones, there is that immediate connection, and we have to understand that the birthing persons, they will connect right away because of the heartbeat, right? Children, the babies need to make sure that they have that connection and they're constantly listening to that rhythm, that heart rhythm that they were used to while they were in their womb. Right. So again, it depends on the individual. It depends on what what the messages are for them. But we have to want to create safety around that? Yes, we do. Right. There's nothing wrong with the mom with the parents sleeping with their children, but we have to create safety parameters around it, right? Because we just want to make sure that we avoid the um any um any any experiences where there is a loss, right?
Yeah,
Um,
thank you for that.
yeah, any comments on that as well? I know, you know, personally, I can say that I did both. I had my kiddos in cribs, but the first couple of weeks, I know that I also had them with me just because I needed to make sure that they felt safe, right? But also that allowed me to make sure that I was feeling safe as well. Right. So there was a thing, that was that component. At one point, I had my son's crib right next to the bed. And so I had to make sure that I was able to make sure that my baby was okay. Right. Or my babies were okay. One of the things that we do have to make sure is that when we are creating that safe space for our babies, that we're not placing a lot of pillows, we're not placing a lot of um blankets around them, because we also know that can also lead to SIDS as well. Right. I did work with a lot of moms that, ended up experiencing this situation, which really was um heartbreaking,
Yeah, I see
heartbreaking
that
for them.
Celeste has left a comment talking about her experience. I don't know if she wants to speak more on that, but
Mhm.
yeah, you guys, if you feel like you relate or can like share insight, please, speak up or make a drop a comment in the chat. Thank you.
Yeah, it can be anxiety driven. But again, I think a lot of it is the comfortness as well. But that comes into the anxiety of is my child going to be okay? Am I going to be able to have that control? Right? Um, oh, it says here, I always made sure. Yes. Uh-huh. And even, I've talked to a lot of parents as well. If it happens to be that parents can take turns, right? Maybe a couple of nights dad can bond with and sleep with child, or mom vice versa, right? But if it happens that parents decide and explore that mom will be sleeping with child, then let's make sure that we set other accommodations for the other adult for them to be able to sleep, right? I sometimes tell them, well, if you have to kick them out of the bed, and we have to kick them out of the bed, right? But I let you know what we have to find out what's going to support to support them to be able to reduce that anxiety overall. I think the best approach in the SIDS community, in the SIDS world, is that it's better that they place some in their own crib on their own. That is the best approach. But again, there are other different options now that we are trying to support that could continue and see that bonding and that connection. Yeah. So I think it depends again. It depends. Yeah. It depends on everybody's experience and what is going to be best fit. And that may not always that may not always uh parents may not always agree on everything, but we also have to see, again, they have to be able to navigate. and see what works, right? So yeah, I mean, I did both, but for the most part, once my kiddos were on their own in their crib, then they were all on their own in their crib. So I know that I've worked with other families where they've had their children sleeping with them for many, many, many years, right? And that's just what's worked for them. But again, it just depends on what the preference is and what the choice is. Yeah, we have to be careful when we leave our little ones alone, because yeah, we can place a lot of pillows and covers around them, especially when they are learning how to roll, because it doesn't matter what bunker you create, hey, they'll just jump over it, right? And that just happens, right? And then that's you have to worry about, is that a safety issue, and or neglect situation as well. Okay, so as far as nutrition, like I had mentioned, vitamin C and omega-3s are going to help the immune system for individuals that may not be eating on a regular basis as well, right? If they can have small snacks and create that. I know that if they can eat, nuts and almonds or cranberries throughout the time, if they're not, let's say that they're not sleeping properly, or they're in between of breastfeeding as well, let's make sure that create a plan, what can they eat during certain times, and what they can snack on, so that they feel they have control over the situation, right? Or where it is that they're in the environment that they are in. Okay. Other form of treatments that we typically tend to be able to support as well is acupuncture or essential oils. And again, like, a mommy's group, right? Again, here we want to focus on what the anxiety looks like for a lot of individuals, and they need to be able to identify it, but verbalize it as well. Right. So I think as professionals here, we need to be able to provide them with an abundance of feeling words, because a lot of times they don't know how to express, or they not realize that they are expressing it. Right. So being able to validate and identify and allow them to, the more often they verbalize it, they are able to identify it when it's arising. Right. One of the things that we want to make sure that we do ask when they are feeling anxious is being able to clarify, what would be the worst case scenario, right? If they're experiencing a lot of anxiety, have that individual explore what would the worst case scenario be, and what would be the best. And what are some of the other possible case scenarios that they would come across? Again, for us as professionals, we want to be able to identify what phases of anxiety are they. Are they all black and white thinking? Are they thinking catastrophically? And be able to also relate that to them and allow for them to explore, why is it that if that they are is it is all black and white, or it is not as they come to a catastrophic situation that the worst case scenario is going to happen, and then it's going to happen. By them being able to ask those questions or provide you with that case scenario, it will allow them to reduce their anxiety and be able to process and stabilize. Right? So we want to reduce um, and limit them from really foretelling what's going to happen, right? Do we already automatically assume the individuals with anxiety already automatically foretell what's going to go on next, right? And so we want to make sure that they are being able to identify the symptoms, being able to be present, being mindful of what they're thinking, what they are experiencing physically, but also emotionally, what exactly is that they are feeling. Any comments around this? No? Okay. Again, we want to make sure that we are able to empower these individuals when they are experiencing anxiety, and just make sure, ask them like how would they handle it and how can they get through it, right? So again, creating a plan around their thinking and their anxiety driven thoughts. Okay. Intrusive thoughts, like I said, it's going to be very common. Obviously, it is not normal, and that happens not only in this population, but it can happen to all of us, right? So I think that it is just something that we need to be able to address the intrusive thoughts and that amount of power that those individuals have and don't have. So a lot of, for us, it's just like we want to control what we cannot control, right? And that is what is it that they are really fixated on that thought, right? So again, it is really being able to provide them, to redirect them, to be able to say stop and be able to redirect and really think about what are those what are those visual reminders, right? What is it that they have to remind themselves to be able to reduce um and stabilize those intrusive thoughts. Any comments? Okay. Again, individuals and or maybe the whole family unit can be very hyper vigilant, right? Because they want to make sure that they are doing the best for their child or their baby, right? In nature, we also see that birthing persons or moms, they are the ones who protect, right? And they know what to do. They know what's best for child. And we understand that is not that is something that we do have to assess, because we have to see what their thought process is, right? We want to be able to allow them to be able to reframe any intrusive thought that they are having. I will share something that I work with a mom. I work with a mom that uh she was a teen mom, and she had two children, and now they were adults. And so 20 years later, um the this couple got pregnant again. And so it was a thing of like they're in shock because they're going to have another baby. Another thing was that it happened 20 years since they had another child, right? And so a lot of it is being able to adapt and also become a first time parent all over again, in that sense of that phase, right? So a lot of her anxiety and her OCD, a lot of her intrusive thoughts when she had her child was, and the reason why she was, we were working together, was because she was having these thoughts of drowning her baby, right? She would think about bathing her baby, but also drowning her baby at the same time. So this was just something that we worked on for months, right? She fed her baby, she clothed her baby, she was nurturing her baby, but when it came to bathing her baby, dad was the one that was responsible for that. Right. And so we worked on it a couple of, for very several months, to be able to reduce her anxiety and about her thought process, and really reframing her thoughts on whether that was really going to happen. So one of the things that I started working with her is like, um, getting those dish containers, those ones from that work from the dollar store, and started having her bathing her child there. Right. She was able to control the situation on how she was able to bathe and the water content, right? And gradually moving forward to a kitchen sink, and to eventually to being able to fully bathe her child in a properly in the tub, or in a baby tub. Right. So a lot of it is just being able to be present with them and work with what can be some possible solutions for them. Right. And reframing those thoughts, and little by little, again, like I mentioned, stabilizing it and reducing that anxiety from that thought. Again, one of the things is some of the things that we also have to make sure that we provide them and that we relate to them is that making sure that they do able to find a support system, right? They need to, one of the best techniques that we can use is, and I typically we can utilize this for anybody in general, is that give them that time to sit for 10 minutes and think about the worst thing that they're experiencing, to worry about it and to set that time for it. And after that, then let it go. Right? Not only are they being mindful of it, they're addressing it, but they're letting that emotion go through. Right? And so again, obviously this takes practice. So these are one of the things that you would want to do in session with them, right? First, so that they can have that control, right? And then little by little, allowing them to use these skills to be able to adapt them on their own at home or wherever it is that they're at. Elia, what was it? You said, okay, Elia said in a drowning scenario, it would be appropriate to discuss where those thoughts were coming from. Um, Again, that is just anxiety and creating safety for that child. We really, a lot of the times we need to make sure that we are able to support them and finding out exactly, yeah, where are those thoughts coming from? But why is it that they feel like that? Do they feel like they have no control over keeping that child safe? Right. So those are the things that we really want to focus on, and not going into depths of like, okay, did this occur to you? But if they do bring it up, then obviously that is another thing that we have to work with them, right? But here in this moment and per se example was that I needed to make sure what safety plan can we create on that for mom, but safety plan for that child as well when it came to bathing this child, right? We weren't concerned about safety in all other situations. We were just creating safety when child was being bathed, right? Again, when we want to be able to provide muscle relaxation because this allows them to tense up all those muscles, but it also allows them to release. And that can provide a reduction in the anxiety. One of the other things that I really like to use with the patients that I work with was blowing balloons or being able to blow through a straw or even getting a plastic bag and then breathing through there as well. Being able to, to breathe for them to really also reduce their anxiety. Again, not every approach is going to work for every individual, but I think we do have to explore. With guided imagery, that helps, but we need to make sure that we identify if there's any trauma, right? If there's any trauma in the past, right? Especially with any sexual trauma, we do have to make sure that we are mindful of that. With guided imagery, we don't want to use any guided imagery that is going to allow them to close their eyes. Right? We want to make sure that there's something that it is functional, that they are able to control. Again, one of the things, grounding techniques that they can do is like, okay, what do you see? What do you hear? What do you smell? There are some quick grounding techniques that you can guide them with so that they can utilize when they are experiencing this as well. One of the things is laughter is very healing, and so I work with believe it or not, I work with some patients that we just, I brought this approach and, a lot of them, they were very skeptical. But just starting to laugh out of nowhere is so contagious. And then it just, again, this just rewires the chemicals and it rewires for the physical component of what they're experiencing to really bring in those serotonin and dopamine levels for them to be able to, again, stabilize. And so again, laughing with just anybody, but especially also laughing with your child just changes the environment, but also the bonding with their baby as well, and it changes the mood. One of the videos that I really like to show is the one where there are individuals that are they're this showing this experiment. I don't know if you guys took it in child development, but is where this mom has this stoic look, and the baby doesn't know how to react. This baby becomes dysregulated, right? But when mom is intuitive and is present and is engaging, then you can just see the engagement and bonding of the child and just how the mood overall is changed. And so it's really important for us to really, when we are working with these individuals, to really see. I always like to have the little ones come with with the individual that I'm working with, because I want to make sure how they bond with child. How do they react? Right? Or do they have this toy look or this engagement? What is their tone of voice with with the little one or with the little ones? Right? I just want to see how they interact. When they are, whether are they feeding them? Are they propping them, or are they taking the time and actually grabbing them and feeding them the bottle, or or breastfeeding them for that matter? Right? Those are, a lot of the things that we have to be Q and I and attentive when we are, when we are working with them, if they are experiencing um, any symptoms. Questions? Okay. This is a brief progressive relaxation technique that we can utilize with them. They don't have to lie down. They can choose to close their eyes or not, but typically it is best if they can close their eyes. And, we allow them to be able, this is a quick relaxation muscle technique that they can utilize to be able to control their breathing and control what is it that they are experiencing in the moment. All right. Any questions? Mhm. Like I mentioned, laughter is super important. So even if, we're not, not in the best mood, or we feel like we're just very tired, finding out if, they can even, you know, limiting the social media also as well. I think it's important for them if they can go on into, there's a lot of reels now, or even if they go onto TikTok and they can look at different, scroll at different videos, and allow them to reframe their mood, right? Or reframe their thoughts. But, I think this is always something that we can utilize to support them. Again, one of the things that we also have to be mindful of letting them know is that they have control of it, right? And they have to, if they are able to use an affirmation, one of the best things that they can do is that I'm doing the best I can, right? And then I need to be kind to myself today, right? If a prayer works, then allow them to pray, validate for them to continue to pray if that supports them, right? Whatever is going to work, allow them to engage and to continue to embrace it. Right. Right. I think one of the things that I do want to be mindful of, as well as also when we are working with individuals, is also to be able to ask what form of contraceptives are they using, because, believe it or not, that does fluctuate, changes, not only chemical changes, but also physiological changes. And in the birthing person that is taking this contraceptive, we want to make sure that it's not creating adverse effects, or it's creating more of a mood influx, right? We want to be able to ask if that is a situation, because this can be a high indication that this can be a indicator that is contributing to either their depression and or anxiety. So it's always best to ask that, but also recommend them to go back either to their general provider or to their OBGYN to be able to assess to see what's going to be a best fit. And this is a route that birthing persons are are utilizing. So this is very important because we have also, I know in the a previous class that we did in consultation at, this can be a high indicator whether individuals can also, their hormones can plummet, and go into also in a psychosis episode. Contraceptives are not the only thing that causes psychotic episodes, just to make that clear. But this can increase as well. This is why we have to assess. Yeah. One of the key things that we want to make sure that we utilize with them is also being able to utilize I statements, how they are feeling. One of the things is that, again, utilizing those core conditions, being able to let them know, I know that you are doing the best you can. And things can get a little bit worse before they can get better. Right. So I think these are some of the things that we need to be able to provide to them so that they can utilize. And again, that is also part of reframing, reframing their thoughts and reframing their feelings, especially when we are trying to communicate with couples, right? Because they may have a lot of expectations or unknown expectations, with taking care of a child and being parents overall. Any questions? Again, we always want to validate, right? I'm never gonna, stop saying that we have to validate at all times. We want to make sure that they're being listened to and they're being heard, right? I think that is the most important thing, that any individual that is experiencing a whirlwind of emotions, that we are able to support them at all times and always let them know that they are not alone. Right, because even though they understand that at most at times they could have the best support system, they can have the structure, they can have, families bringing in meals for them. They have everything, but still, there's still that sense of loneliness. There's still that sense of voidness, right? And so we want to make sure that they know that they are not alone, right? Um, Again, we also want to assess for any intimacy issues that are going around within the relationship, because this can also bring up a big toll in in the bonding and relationship of the child, but the whole family per se, and the couples as well. Right? It's always good to be able to have them set some time for them to just bond, even if it's just watching the show or just sitting in a common area and just sitting there and be able to have a conversation. You may not always have control of everything, but if they can set that time aside, not only for their own self-care, but but care within the relationship, that is going to support them, and it's gonna go a long way. Right? Questions? Take a time to 25. Okay. I want to go into this component of bonding with your little one. Um, One key thing here as well is that I know that I had focused more on in birthing persons that have actually, that they have had their babies, but we also have to be mindful that this can also affect foster parents, right? Any guardian parents, adopted parents as well. Even though that they have not delivered this child, they will still go through the same emotional biological reactions as if this child was of their own, right? So we also have to be, you know, mindful of that as well, that they can experience that. Not only the adjustment part, but also being able to identify whether they are experiencing depression or anxiety and adjustment, just, you know, overall the whole, you know, situation that they are experiencing in the moment. So I do want to be able to specify that, right? Again, when we were able to redirect our feelings, we were able to create that attachment, right, in a more natural way. It doesn't feel forced, right? Sometimes when I work with my, you know, with patients, is that they say like, it feels forced. I don't feel like I'm bonding, right? It's just, they feel like that it's just not working. But again, it's going to take some time to reconnect, right? So it is not going to be immediate, but they have to be patient enough to make sure that when that bonding fully, when they feel satisfied and they feel safe that they are bonding, that it will become very natural to them as well. So one of the things that are very important too when it comes to bonding as well is that if we are able to storytell, or if we're able to sing any songs to our babies, you know, maybe that's not something that was that you were brought up with, right? But maybe incorporating it, right? I think a lot of it is also being comfortable and adapting it and being able to give it an opportunity to see how the difference and what changes can you do as far as bonding, um not only with your baby, but for any of your children per se, and or also with your support system. So again, doing silly faces, and I know that for us that you know, when we're working with babies or doing, you know, if we decide to go more of the infant mental health approach, is how um I lost my thought. Okay, being able to do silly faces, etc., is going to, you know, take us a very long way. So I know at times it said, you know, some people have said, well, fake it till you make it, right? Even though you're not feeling it, it's not coming out of you. Like how you say, no te nace. Like it doesn't come out of you to just be like this. Again, even when we're laughing, we just start to laugh. Let's do the same thing for when we were interacting with the little ones, right? Or with our children as well. Even, you know, you know, I really don't like using fake it till you make it, but at times for some individuals, it goes a long way, right? Again, this will eventually redirect and stabilize and change those chemicals to be able to reduce those serotonin levels. No? So again, when we are feeling in doubt, or these individuals are feeling really um they're not feeling like they are continuing to connect, again, like I had mentioned, massaging them is really important. And so that's another component that we will have to go into that we don't have the time for the sake of today, but it's important. A lot of it is also for individuals as well. If they're, we have to be very critical as well to be able to ask these situations as well. If they are breastfeeding, do they feel like that is the only way? Yes, baby massaging does help with colics, right? But we also have to ask, right? If culturally, if there are any other cultural rituals or any other homeopathic approaches that could support the colic, right? But yes, that does support that, but also again, more than anything, it promotes that bonding and that attachment, right? Reconnecting and changing those chemical um uh the stimuli that we have, and to be able to change it and turn it around for more on a positive way. So even brushing a baby's hair, right? Even yourself, when you're doing this or you're massaging your hair, that creates a change. that'll create a mood and change in what you are doing, right? So being able to do that as well. One of the things that I wanted to go into as far as like breastfeeding, that there are some individuals as well that we have to be mindful of, that they can create a lot of feel, go into depression or anxiety. Is as if they were able to be able to do a natural birth versus a C-section. Right. I think a lot of we want to be able to ask about those questions as well, because believe it or not, that can also create um an attachment or unattachment. Right. Some individuals feel like they don't feel that have completed within their full entirely role, because they either did not deliver naturally and they had to go through the C-section route. Right. A lot of it is that, we cannot foresee what delivery is going to look like. And so we also have to be able to validate and understand, the situation that they went through. Right. It's also as breastfeeding. If individuals that are breastfeeding, if they're not able to breastfeed for a very long period of time because of other medical conditions or medication that they have to take, or something just abruptly happened, or they tried so many different things, mother's milk, they tried so many other different approaches to be able to produce, and they were just not able to produce, then being able, they may feel that was the only form of way of them connecting with their child. All right. So being able to assess and ask that as well, because this can create a big problem as well. Mm-hmm. Yes. Having a C-section, the uh the breast milk takes a little bit longer to come in, just because of all the medications and just of everything, the process that had to happen. So a lot of anxiety can come into also not being able to feel like you're being the best fit parent, because you're not able to breastfeed, or that milk supply is not coming in as you want, right? But again, we need to relax. If we are stressed out, that milk supply is not going to come in. Okay, we also have to be mindful of that and be able to provide them with that information. Right? We need to be as stress free as possible, within the limits that you have, to be able to provide that, right? Because we want to make sure that we are providing the most nutrition milk supply, versus something that is going to not support them. I think somebody had another comment. Like, again, there's just so much stuff that we can go into, but we don't have time. Oh, that is why we're creating a class. Okay. Being able to express their emotions, right? To be playful. Right? You don't have to buy a lot of gadgets. You don't have to, you don't have to do so many different things to be able to bond with child. Just with what we have in our home, just being silly and try to let go. Right? That's going to be able to help that connection and bonding. And having that eye-to-eye contact, right? That is going to be super important for that child to thrive, for that child to feel secure, for that child to have that social emotional intact when they're older, right? And reduce a lot of more of that anxiety, right? And this is where we have these babies too that become very colicky, or they become very anxious when they are growing up as well, right? A lot of it is also, we also have to assess, is there any other things or other conditions that these kiddos are going through in the moment as well. But bonding is the key, right? And then reducing as much anxiety as possible. Then these kiddos are going to be able to learn how to emotionally and socially regulate, right? I think this is the most important thing about bonding, is that the most bonding that they have is it's how they are able to regulate as well on their own, and not constantly being directed. Right. Positive attention, right? I think that those are some of the things that we also have to be able to assess, like what's going on. Do we smile with our children, right? Are we making that eye contact? And again, also within the parameters of culturally, we have to be mindful, if eye contact is a sign of disrespect or not, then we have to make sure that we create a plan around it, right? We have to be mindful of all these different things. We want to make sure that we are utilizing words, not only for ourselves to be positive within ourselves of what we're doing, but also further for our little ones. And obviously always to um, be able to celebrate all the achievements and all the activities, even those that may not did go well, right? To be able to be that be able to really provide that encouragement in any achievement, right? Yeah, we have to put our phone away. So when we're working with patients, we want to make sure that we set that time and we make sure that they are not engaged, because typically this is what we do all the time now. Even when we're eating, wherever we're at, I think that in order for us to create that connection, we need to put a lot of the things that are taking time away from us as well. So, any questions? Hmm? Okay. Well, there's a lot of myths on this, but again, a lot of it is also culturally driven, right? We want to be able to assess, right? I know culturally when I was, learning from my aunts and my mom and anybody around me as well, they would say like, well, don't, when I had my children, don't hold them for so long, because then you're going to spoil them. And then once you go back to school or you go to work and whoever's taking care of that child, they're going to be fuzzy and they're not going to allow them to, carry on with their other duties. Right? That is a myth. Holding and then crying is a sense of them letting you know they're using their language, letting you know that they don't feel safe, right? They need that connection. They need that warmth, right? They need that skin to skin. Right. So it's really important that we assess for that as well. Right. If there are some parents that say, well, I really don't want to hold them because I don't want to spoil them, or I was told that I will spoil them. Well, then, let's create that conversation around it. Right. What does that bring to the adult, and what is that creating for the child as well? Right. I've seen parents that just don't hold their children for a very long time because we're taught that they need to self-soothe. Yes, it's important that they learn how to self-regulate, but we also need to guide them with that. But if we don't guide them at all, how are they going to learn? Right. So a lot of it is that consistency and a lot of it is that guidance. Right. So we need to make sure that we assess, are they hungry? Are they tired? What is it that they're experiencing? Are they sick? Are they colicky? Right? There's going to be some babies that are going to be good. They're born, they're good, they eat, they sleep, they are thriving. And some other little ones are going to be, they'll cry all the time, they'll be colicky, they'll have some allergies. I mean, you just name it. And that's another thing that we have to, as adults, we have to make sure that we monitor. Right? It's just so many things that we have to take into consideration. Okay. Coping skills. I was just asking that is something that you were asking for. Here we go.
Yes, thank you.
But believe it or not, everything that I've been teaching you is a coping skill. Again, what have we learned? Obviously, that is depression, anxiety going to go away? No, but it is manageable, right? And it's manageable within time. One of the key things is that we have to know is that if individuals are able to identify it ahead of time, within 6 months of their symptoms, this phase in time is they're able to manage it and overcome it. Right? It is manageable, but we have to treat it as soon as possible. If we prolong it, if the depression and anxiety continue from years and years and on, then it'll become chronic, but understanding that it is manageable, right? And a lot of it is the coping skills that they have. One of the key things that I also make sure that they do with their medical providers, because again, it is not only the work that we're going to be doing with them in session, but as well as what they need to navigate outside, right? One of the key things as well is that they need to make sure is that are they running any blood tests? Are they going to their medical providers? Right? Are they letting them know about the symptoms that they're experiencing? One of the key things that it's really important for birthing persons that after they have delivered is that they make sure that their providers, OBGYNs or medical, their general providers provide a full thyroid panel. And the reason why I say a full thyroid panel is because sometimes the hormones may be unbalanced, right? And even though you're trying so many approaches to regulate, we still need this can be more of a medical concern, right? So this is why it's important to be able to address and assess all these different things. And again, if medication is possible, then we need to be able to support them and address it, right? And support them and follow up with them step by step, making sure that we're monitoring what are they feeling, what they're experiencing, right? And so they need to take time for themselves, right? They need to advocate for themselves, but we are also providing that advocate piece if this is something that they're just learning about themselves, right? So again, we need to make sure that we are providing them with that support that they need to communicate. They do not communicate, then it is very limited to what anybody can support them with, right? Even if there is that, even if they're communicating, if there's not that support, okay, let's create something else that's going to support them along the way, right? When things go tough, right, what can we do, right? How can we work around it? Again, some of the things that they can do, and we talked about it, and at times when they are experiencing with depression and anxiety, their self-care is a must. Even doing a different hairdo or putting some makeup on, whether they do that or not, okay, that's fine, right? But what is it that they can do for themselves to feel better, to feel good about themselves, to regain some of that identity? Because when we become parents, we come across different identities. And again, like professionals, we wear many hats, as well as parents, we wear many hats. And so a lot of the times we do tend to lose our sense of identity and we lose ourselves along the process, right? So a lot of it is being able to come back to yourself and also be able to attend so that they are able to support themselves along the way with this process and their journey and navigating what they are experiencing in the moment, right? Again, skin to skin is very important, not only with the child, but also with the adults as well. Hugging is important, right? Even shaking a hand, that creates a stimuli. A hug, a, a pat, that is going to go a long way, right? And also letting them understand that what they're going through, and understand what they're going through will allow them to heal much sooner, right? Even though that it will take a process, again, a lot of it is how long they have been experiencing this for and how much of it has not been treated, right? And so it can take time and it will take time for individuals. Okay. Any questions? Questions or comments?
I mean, I just want to say, Rocio, thank you for facilitating this workshop for everyone. I think you provided us with a wealth of information regarding this topic. I know that we obviously, like in our programs, can't fully learn everything, and this isn't even something that we, even remotely touch on that with the classes that are built into our curriculum. So we appreciate this opportunity to even get like a little glimpse into this part of the world when it comes to this type of care for moms and other people included. Yeah.
Yeah, so I've done these type of trainings, but honestly, it takes about a day or two to be able to provide these trainings. So those that are interested and really want to go more into depth and really focusing on the breastfeeding component substance. One of the things that one of the tools that I did not um provide you with, and let me go ahead and bring this, is that one of the key tools that we need to utilize when we are assessing is that a lot of medical providers use the Edinburgh scale. That is good for throughout pregnancy, but the one that needs to be utilized at all times, and that is a general um, tool that we can use, is the PHQ-9, right? The PHQ-9, let me see. Where are we at? I lost myself. Where's Zoom? Oh, here it is. Wait, can we see this? We can see this, right? So it's in our library and therapy notes as well, but the PHQ-9, this is a form that we want to use at all times when we are working with individuals. Um, this assesses depression, it assesses a little bit of anxiety, but the key thing here that I want to really focus on, that it questions 8, 9, and then the bottom one as well. All of them are important, right? But I really want, what really assesses here is that it can give us indicators where they're experiencing any ideation, is obviously questions 8 and 9. We want to assess, how they have been feeling um and within the last 2 weeks, or continuously. We want to make sure that we are offering this assessment, but as well as this question in the bottom, it also assesses a little bit for IPV, even if individuals are not there to be able to really open up about that, if that is something that they're experiencing. But this can be a very high indicator depending on where they check, that you can bring up this and be able to process that with them. If you are working with individuals that have had substance in the past or currently dealing with substance, one of the other great tools that we can utilize is the expert, and this is something that the medical providers use. It's a quick questionnaire that it is approachable for adolescents. We also have to keep that in mind, that parents, teen parents, have a different form of assessment when it comes to substances. So we want to be able to, let me see. Oh, it's not coming up. Okay. Yeah, but the Esper is a great tool that we can utilize. So again, it really monitors their beer intake, alcohol intake, any other substances, because that in itself, you know, we have to also focus on. I mean, there's just so many things that we can go on and on about this, but in general, we just need to be able to, as long as we know the basics of being able how to assess, then obviously we can use a lot of other coping skills that we typically use with our um general population as well. But you tailor it within it that is going to support the symptoms. Okay. Any other questions?
Rocio, I had a quick question. You mentioned a couple of occasions giving somebody with postpartum depression some sort of medical kind of insight. How do we go about doing that without it being seen as unethical, since we're not supposed to be giving them medical advice?
What was the question again?
So I think there was one occasion where you mentioned that patients need to get their thyroid levels checked and also pay attention to their vitamin D consumption. So how do we go about giving patients that type of advice without being kind of seen as being unethical?
So not advice, but more of a checkup, just to see when we are assessing, like, oh, when was the last time you've gone to your medical provider? You know, have you gone some blood drawn out? If not, because this is just something that in general, this is something that they're going to do. And this is specifically for this population, we need to ask those questions. Yes, you're not an expert in thyroidism or in any form of that matter, but it's just something that we want to make sure that they go and check all their hormone levels. So we were able to place it like that is more of a checkup. It's not something that like, oh, well, it may be because of this. No, we want to make sure that we not only are addressing our component, because we want to make sure that we rule out, right? We want to make sure that the symptoms that they're experiencing does not also have that is due to a physical medical component, right? So we need to make sure that they go back to their provider and ask these form of questions. And this is not providing advice. This is just more of a check of like, hey, besides doing what we're doing here, let's make sure that we monitor you and more in the physical component and make sure that everything else there is okay.
So in essence, kind of just putting it out there that have you considered these things, and it might be a good idea for you to go get a physical or a checkup.
Mm-hmm. Well, at least
Okay.
that's something that we, you know, that when I worked with this population, that's something that we always have to address. And that it just ties with the medical providers, nurses, public health, that they do ask all these questions within this population.
Thank you.
But this is just because it's within that time frame that it's important to be able to ask. Not that you're gonna go into details about what their if they do have a thyroid diagnoses, that you're gonna going to go into depth about what that is, right? That is not what we would do. Just more of a say for following up. It's just more following up with them and making sure that they are able to go and get checked medically. So I don't know if I answered your question. Okay. Any other questions? Nope. All right. Well, thank you so much for giving me this opportunity to share a little glimpse of what the peripartum world is about.
Awesome. Thank you so much, Rocio. Again, everyone, this session was recorded, so you can go ahead and find it in the future on the MFTSA YouTube page.
Thanks, Rocio and Ash. See you in 5 minutes.
That's right.